All right, let's draw the suboccipital triangle. And as we do, we're going to talk about the muscles that make up the suboccipital triangle, and we'll also go over the contents found within the suboccipital triangle. I'm Parker, and this is Anatomy with Parker Ballard. To start, we're going to draw some bony landmarks, the first being the C1 posterior tubercle, which is basically the spinous process of C1. Second, we're going to draw the spinous process of C2, which is bifid, and so we're going to add that to our image here. And then the third and last one is going to be the C1 transverse process. And these landmarks are all going to serve as attachment points for the suboccipital muscles. The first muscle being obliquus capitis inferior from the C2 spinous process to the C1 transverse process. And then next we're going to have obliquus capitis superior from the C1 transverse process to the inferior nuchal line of the occipital bone. Next, we have rectus capitis posterior major from C2 spinous process to the occipital bone. And then last, we have rectus capitis posterior minor from the C1 posterior tubercle to the occipital bone. You can see three of those four muscles create this triangular space, and that is the suboccipital triangle. So now we'll go over some of the contents found within that triangle, the first being the vertebral artery. And during dissection, it's always really deep, and I think it looks like a macaroni noodle when you find it, so that's why I draw it like that. Also within the triangle is the C1 dorsal ramus, which is aptly named the suboccipital nerve because it's going to innervate all four of these suboccipital muscles, and that's about it. It really doesn't do any sensory. Then finally, looping under the obliquus capitis inferior is the C2 dorsal ramus, also known as the greater occipital nerve. It gets its name because it's going to end up doing a lot of the sensory innervation that C1 would have done, but it just doesn't since it just innervates the suboccipital muscles. Then I'm adding the semispinalis capitis muscle because the greater occipital nerve is going to pierce through that muscle to be able to do sensory innervation to the skin at the posterior part of the skull. There's also a venous plexus within the suboccipital triangle. It's not going to be super important for you to be able to ID that, so I just didn't add it to this image. I also want to briefly talk about muscle function here. All four of these muscles are relatively small, but they have been found to help with proprioception, or letting us know how our head and neck are moving in space. All four of these muscles will also help with extension of the head, but then I'm going to add a few arrows here onto rectus capitis posterior minor, rectus capitis posterior major, and obliquus capitis inferior. You can see those three muscles have a similar fiber orientation, so those are also going to perform ipsilateral rotation of the head. And then the fiber orientation of obliquus capitis superior is perpendicular to the other three, and so that is going to perform contralateral rotation of the head. So to finish this off, we're going to do a clinical case. A patient comes to your clinic with an injury to the right C1 dorsal ramus. Which of the following symptoms would this patient most likely be experiencing? A, loss of motor innervation to the right suboccipital muscles. B, loss of sensory innervation to the skin over the right posterior skull. Or C, loss of motor innervation to the right suboccipital muscles and loss of sensory innervation to the skin over the right posterior skull. So I'll give you a second if you want to pause and think about it. So the correct answer is A, loss of motor innervation to the right suboccipital muscles. Again, the C1 dorsal ramus is the suboccipital nerve. That nerve innervates the four suboccipital muscles, but it really doesn't do any sensory. B is incorrect because it is describing the role of the C2 dorsal ramus, which again is the greater occipital nerve. That nerve is responsible for doing most of the sensory innervation to the skin on the posterior aspect of the skull. And then C is incorrect because that is describing the roles of two separate nerves, both the C1 and C2 dorsal rami. So I'm going to center back up our image and throw on some labels. In this video, we've gone over drawing the suboccipital muscles to understand the relationships with the muscles and the nerves and all of the attachments. You'll find this drawing to be a really helpful resource when you're identifying these structures in lab, because knowing the muscle attachment points and how the nerves run in relation to the muscles will help you to confidently identify these structures. But yeah, those are the suboccipital muscles and the suboccipital triangle. So thank you guys so much for watching.